Hi y'all, it is my 4-month update. I had VSG to RNY revision on June 9th, 2021. Today is October 9th, 2021. I had a starting weight before my surgery, before my pre-op diet of 282 pounds. I am 235 pounds, and my good news is that my husband is home from deployment. So I have actually been losing a little bit better since he came home, just because I feel like I'm not mindlessly snacking or boredom eating or overdoing any late night snacking. So that's been really good. There are some health things that have come up with me, so let me go over those real quick. I noticed that I was having really intense eye problems. I did get my lashes done, and so I thought that it was the lashes that caused the problem, but I went to my optometrist, and she said that actually the issues seemed to be hormonal. So she gave me these eye drops, and she told me to do these steroid eye drops 1 time a day, and then do the blink gel tears 4 times a day. So I've been doing that, and it has helped me significantly. Although if I do miss and I don't take them, I notice that the problems come right back. The other thing that's happened is I've been going back and forth to a dermatologist because I've been having really terrible, and you can see right here, like an old one, cystic acne. And it's coming up in my jawline. Like you can see one's right there, one is right there, right there. So I'm also getting them in my jaw line all the way around. So you can see like I have like really bad clogged pores here. I have been washing my face with just a St. Ives acne control apricot scrub kind of deal, and that wasn't doing it. So then they gave me some prescription retin-A cream to spot treat like the bad spots, and I waited a month and I used that every single night, and honestly I just rubbed it on my whole face because my whole face is a problem area. So that was not, it wasn't not working, but it wasn't working as good as I needed it to. Also, I had when I first started that skin regimen, I had stepped on like a thorn in my yard near my chicken coop. It got infected. I went to the podiatrist. He took it out. I had an infection, so I was on an antibiotic. And when I went to the dermatologist the next day, they said, "Oh, that antibiotic's great for clearing up acne and stuff." And it did. Like, I had 10 days of clear skin. It was wonderful. And then when I got off the antibiotic, the acne came right back, and it's very, very, very painful acne. And I have never had skin issues like this before in my entire life. I do remember the last time I lost weight, I had some skin issues, but not to this extent, and not cystic acne. So I went back to the dermatologist. I even called and made an earlier appointment because it was really bothering me. So I'm still going to do my regular face scrub in the shower. I'm still going to do the retin-A cream at night to spot treat, or rub all over my whole face. And then I'm going to, I did start taking a medication. Honestly, I can't remember the name of it, but basically it used to be like a blood pressure medication, but they said they were giving me such a low dose it shouldn't affect my blood pressure. It doesn't seem to have affected my blood pressure. They said it won't affect my birth control, and it kind of like works actually in conjunction with birth control, so it makes it even like harder for you to get pregnant, which is kind of what I want because I got 4 kids. And anyways, I'm just taking that 1 time a day, And they said the downfall to that medication is it takes about 3 months to start really working. So we basically have to just sit and wait for 3 months and see if it clears my skin. But essentially, it will start to lower my testosterone level. Now, I am a little bit concerned about lowering my testosterone level because I want to start working out more than I already am. And so, anyways, I'm going to be doing my 3 month post-op appointment coming up soon because of COVID. Everything got pushed way back. So even though I'm 4 months post-op, this was supposed to be my 3 month post-op. So anyways, I still have to do blood work and all that and see my physician's assistant. And I'm going to talk to her about like, hey, what's your opinion on this? But right now I'm still losing weight. So I don't think it's causing weight gain issues or anything like that. I don't think my GERD is bad, but I didn't think my GERD was bad before I knew I had GERD. And I have Barrett's esophagus and precancerous dysplasia in my esophagus. So I'm actually scheduled for an EGD this month. And then I will do the follow-up appointment early November. And I'll be sure to let y'all know how that goes. Basically, I am not on any GERD medication because they want to see if basically the surgery worked to cure my GERD and start letting those tissues heal. Now, I did take GERD medication for the first month after surgery, but then after that, I stopped just so that we can see what the status is. If there's any more damage or doesn't look like there's healing going on, then I'm going to go back onto the GERD medication. But the whole point of the surgery was to hopefully make it so I don't have to take GERD medication for the rest of my life. Although there is apparently some controversy with my doctors about that, and I'll let you know how that goes. Some of them are saying, no, the surgery is going to cure you. You're not going to need to take this medication anymore. You're good. That would be my weight loss surgeon. My gastroenterologist's physician's assistant said, no, you have to be on that medication the rest of your life no matter what. And I was like, I don't know. So we're going to work this out over the next month. For right now, I'm not taking the medication, and I'll start taking the medication again if those EGD results are not favorable or inconclusive or concerning or any of that, because I don't want to mess around with cancer. Speaking of cancer, when I went back to the dermatologist about the acne going on, I said, hey, I have a family history of skin cancer with melanoma, with my grandmother having it, and I just don't want to take any chances. I live in Southeast Georgia, so can we just do a skin check? Yeah, sure, not a problem, skin check. So we did the skin check, and they have you wear like this little paper shirt and like these little ugly shorts. And he was like, okay, is there anything that's like covered up that is concerning? And I was like, well, I have this little tiny mole thing, freckle on my chest. I've had it my whole life. He looked at it. It's literally right here. Like, it's not in an indecent place. But he looked at that. He was like, oh, no, that's fine. No worries. He said, is there anything else? I said, well, there's this one other spot, and it's on my butt, so you probably don't want to see it. He was like, no, I want to see it. So I pulled my underwear to the side. He's looking at my butt for like less than 2 seconds, and he's like, that needs to come off right now. And I said, what? And he's like, already got like this tray of stuff out. And I was like, right now it needs to come off my body, like right this second. He was like, yeah, that needs to come off right now. And I was like, what? I'm not prepared for this. So essentially, I'm like basically naked almost in the dermatologist's office, laying on my stomach on this table that he's already laid down. He's like shooting up my butt with lidocaine, and I'm a dental assistant, so like I'm used to like using lidocaine on patients like in the mouth and stuff, and it's completely different when you get lidocaine in a different part of your body. Like, I've had a lot of oral procedures and lidocaine in my time, and it does not hurt the same way that it hurts when they put lidocaine in your butt. I am here to tell you. But it did completely numb me so fast. I did not feel anything. He put a little band-aid on there. He said I burned a scar on there. Or like a scab on there. You're gonna be fine. Eventually it's gonna heal up. There'll be a little pink circle and you'll be good. I said, any restrictions? Uh, any like restrictions with relations with my husband? He was like, nope, you're all good. I said, can I shower and everything? He's like, yeah, good. I was like, okay, great. He did suggest keeping a band-aid on it for a couple days. I was like, okay, not a problem. So it's in a difficult place. Like, I can't personally see it because it's on my butt. So, like, I asked my husband to, like, help me change the Band-Aid the first day, like, the next day after. And he's changing the Band-Aid, and, like, we have the new Band-Aid ready. He takes the old Band-Aid off, and he goes, oh, my God. And I was like, what? And he said, there's a hole in your butt. And I was like, what? And he said, it is a hole. He's like, this is not a little, like, scratch off the surface. I was like, oh, yeah. So the dermatologist told me that he was sending that little piece of skin off to the lab to get tested to see if it was cancerous or if there was anything unusual about it or whatever. And he told me that even if it did come back cancerous, that he got all of it. And I was like, okay, good, I guess. Great. So my husband was kind of like a little traumatized. He was like, do you want me to take a picture of it so you can see? I was like, no, I'm good. I don't want to see the hole that is there because I think it's going to freak me out. But it did start kind of being sore the next day, and it was kind of sore today. So I'm kind of like sitting on my side so that I don't sit right on it because it is a little painful. Not like bad, but just like uncomfortable. So yeah, I'll let y'all know how that goes. What else? I'm thinking about calling on Tuesday to try to figure out what prerequisites I need for dental hygiene and trying to get started because it's like a rolling enrollment. I want to try to get started. There's a set of classes that start at the end of October. And I want to try to get my prereqs done so that hopefully I can apply for dental hygiene school in the spring. That's kind of like my goal. I want to get my dental hygiene license. Oh, sorry guys. I want to get my dental hygiene license and go back to work because I miss working so bad. But I definitely want to go back as a hygienist and make more money, essentially. What else? I can't think of anything. It's also late at night and I'm exhausted. Oh, as far as working out is going, I'm doing Aqua Zumba, but I'm not going as much as I should. They have it twice a week, and I just went on Monday this week, and then I skipped Tuesday. But also, my husband just came home, and I'm trying to spend time with him. I have been Instacart shopping as like a side hustle for some extra money, and it's going good. Like, no big complaints. I don't do it every day or for very long, but I made like, I think $91 today, and I only worked for 4 hours, 4.5 hours, something like that. So it's good. And then what else? We got zoo passes for our family for the year to the Jacksonville Zoo. We've been going a lot, and that is a lot of walking, y'all. So I've been doing a lot of walking. My husband and I just power walked like 3 miles tonight after dinner, plus all the Instacart shopping. And I did lug some groceries up to the 3rd floor of an apartment building. And I only did one trip, so like the bags were very heavy. And I'm pretty proud of myself. I was able to do that. I do not think I could have done that a few months ago. Oh, another big update is clothes. My clothes are all too big, like way, way too big. So I went clothing shopping. I just went to Walmart and got like literally, I think, two things. I got like a pair of jeggings and I got a pair of like workout capris. And I'm gonna try to go by Goodwill and get some more stuff or see if I can score something like on a good deal on Facebook in one of my like wives groups. People are always getting rid of stuff. I also like had given a bunch of my clothes to my mom because she had had weight loss surgery, and I want to see if she has any like of the size I'm in. But basically, when I had surgery, I was wearing size 26, 28, and now I'm wearing like 16, 18, closer to 18. But I also put on like a junior size 15, 17, which I was really surprised that I fit into. To the point where my husband and I got into a fight in the store about whether or not I could fit into them. And he was correct. I could fit into them. Also, for like shirt sizes, I really think I'm like in an extra large now. And I don't own anything that's extra large. So really basically tomorrow my big plan is to go through my closet and just get everything that is too big for me out because I look frumpy, like bad. And it's not cute. It's not like a cute frumpy. It's like a frumpy. So, yeah, and I don't want to spend a fortune on clothes because my goal is to be at like a 16, 18 for a very short time. I would like to get down to like a 12, 14 back where I was. So honestly, like I told my husband the other day, I was like, if I get to a size 12, I promise I will not bitch at all. I will be thankful. I will be grateful. I will remember. And he totally laughed because I said that last time and I got to a 12 and I was completely upset. And he said, you're not going to be happy, like no matter what, because thank you, body dysmorphic disorder. So anyways, I said, no, like I promise I'll be thankful if I can get to a size 12. And he's like, all right, we'll see. But I was like, you just have to remind me that we had this conversation and that I said I would be thankful. And then I'm going to say something like, I know I said that I would be thankful at a size 12, but also, I mean, really, my ultimate goal, I think, is to have skin surgery and have like a tummy tuck. And I'm on the fence about getting anything else done. Honestly, if I got anything else done, it would need to be my thighs. But I'm a big old chicken, and I think that would be so painful. So I don't know. And if I did do it, I would need to do the tummy tuck and thighs at the same time because I think I would wimp out like bad. And I mean, yeah, that's kind of like one of my goals. Right now, our big money goals are get me through school. My husband's going to start using up his TA to go to school while he's on chore duty. And set ourselves up financially for him to exit the Navy. And get my skin surgeries. And what else? Get braces on all of our kids. Zoe, our oldest, she's getting braces on the 14th. So I'm excited about that. But yeah, those are kind of the things we're saving for right now. Yeah, life's going good. I'm happy. I haven't had to like go back to taking any psychotropic medications, but I have really had a hard time with this last deployment, like to the point where I sent my kids to go live at other people's houses temporarily for a few days at a time over the last couple weeks because it was so hard, mentally and emotionally. But now we're kind of all refreshed a little bit since my husband's home, and we're doing family therapy and individual therapy, and I'm about to start that therapy where they like do EMDR or EDMR where they like do the eye movement thing. I'm going to try to start that in November. So, yeah, work on some of my like PTSD, anxiety issues. So I'll let y'all know how that goes too. This went way longer than I had planned, but I haven't done a good update in a while. So, yeah, I'll try to do another update maybe in 2 weeks and let y'all know how some of this stuff is going and kind of what's happening. Um, oh, we did decide to keep our kids homeschooled. I had sent them and then took them out because one of them had a COVID exposure and the school system was going to make me send the other two. So basically, what we decided to do was my oldest is vaccinated. She's 12 and she wears masks, and the school has mask mandates. So I feel pretty comfortable with her going. She's been going to school, no issues. My younger three kids obviously are not vaccinated, not old enough to be vaccinated. So for the time being, my husband and I decided to keep them home homeschooling. And so that's what we're doing until they can be vaccinated.